there's been a lot of advances in the treatment of renal cell carcinoma now where immunotherapy-based combinations are the standard of care in the frontline setting. And there's been a couple of trials done recently that have shown that in patients progressing immunotherapy, adding a TKI, be it tivozanib or cabo, to immunotherapy is no better than just switching to a TKI alone. And the two trials, Contact 3, Tenevo 2, had slightly different eligibility criteria, but at the end of the day, one of the key differences was Contact 3, which looked at cabozantinib, optimized the dose of the TKI in the combination, giving full dose in both arms, where with Tenevo 2, given concerns about hypertension with a combination, those patients who got the combination actually got a lower dose of tivozanib. And there were actually numerically worse outcomes in the patients who got the combination. So this was an analysis looking at the data from all the trials been done with tivozanib overall, to include Tenevo 2 as well as monotherapy trials to really get a sense on what is the right dose of tivozanib. And is the dose that has been chosen, the 1.34 milligrams by mouth, day 1 through 21, every 28 days, is that the right dose? And what they did by looking at all these different analyses, they showed that one, that nivolumab does not affect the tivozanib pharmacokinetics. And we also showed that the incidence of grade 3 hypertension was actually not significantly different if patients got 1.34 or 0.89, but tumor size reduction revealed a significant relationship with TiVo exposure. So the higher the dose, the greater the tumor effect. So ultimately, this, I think, important analysis showed that the higher dose of tivozanib, 1.34 day 1 to 21 every 28 days, provides greater anti-tumor activity than the lower dose, while the actual hypertension incidence was very much comparable. And it shows that optimizing TKI dose is important. And so as we think about managing kidney cancer moving forward, I think it's important to start with the recommended dose and adjust as needed for toxicity, because I think data such as this shows that there is certainly a correlation with starting dose and tumor efficacy.